Further discussion? Senator Jensen.
Thank you, Madam President. Colleagues, this morning my first physical exam was at 8 o'clock, and it was a woman who drove an hour and a half. And I asked her, why did you pass all those clinics to come here? And she said, well, I heard from my mother that if I come to this clinic, we'll have a relationship. She said, I don't seem to be able to find that. A year and a half ago, I poured my heart out into a book, and I wrote a book about relationship matters. 2.5 months ago, I first addressed this body, and I spoke about relief, reform, and access. We provided relief. We put out $315 million to, if you will, reduce the impact on the individual marketplace. So here we sit. We haven't done a great deal of access work. We've done some reform. This bill does that. But I think Senator Lori's amendment does address access. And without access, you cannot have a relationship. What I'm hearing, I haven't heard a thing about people wanting a big tax break this time around. I'm hearing people just absolutely petrified that they might lose their health insurance or that their friends or family may lose their health insurance. Somehow we have to get at access. The worst thing we could do as a body is to, at the end of the day or at the end of the session, have areas where people are driving 60 to 90 minutes to get their pneumonia treated or whatever. We need to have a more robust discussion about what's driving up the cost of health care, because usually at the end of the day, it's simply the cost of the things we do and the number of times we do those things, whether it's an appendectomy and a couple of office calls and an angiography, and then we multiply it by the price. But we haven't had that discussion yet. We've been playing a shell game, taking $315 million in January and making some moves with that, and now we're talking about another $600 million. Senator Lori has been open with me, and I know with Senator Benson, and he did take the 7-county metro area out at my request so that there would be no clear attempt to, in some way or another, undercut our major health insurance companies. That's not the intent here. I would prefer that Senator Lori would go further and that any county in which 2 major insurance companies said, we will be there, would then be disqualified, and we would not have MinCare buy-in. That can be discussed at a conference committee. 30 years ago, Reagan said, tear down this wall. We have to tear down this wall of partisanship. People are counting on us to get this done. I know the Democrats in 2013 could have done things better, but I'm going to guess the Republicans could have done something better in 2012 too. In the next minute or two, I'll make up my mind as to whether or not I'm going to support this amendment. But at the present time, I certainly appreciate that it's on the floor, being discussed, because this is one way that we can, at the end of the day, make certain that every county in the state of Minnesota has at least one option for every patient. Thank you, Madam President.
Senator Schoen. Senator Schoen. Senator Klein.
Well, thank you, Madam President. There's been quite a bit of nostalgia tonight. I am not so nostalgic. I'm not nostalgic by nature, and I also don't pine for the halcyon days before the ACA, when America had 40 million people uninsured, and I've shared that previously. I supported the Affordable Care Act when it was introduced. I supported it because I believed that we are a strong enough and a good enough nation to ensure health care for all of us, and I still believe that. And I supported it because we were partnering with the insurance industry. I hoped that the insurance business, with a bottom line to balance and board members to answer, would make the shrewd decisions that control medical costs. Government would defend the patients and the insurance industry would regulate costs. I didn't delude myself that the insurance industry shared our goal of providing health care for all. Having served myself on the board of directors of a large for-profit health insurer in Wisconsin, I knew that those noble and humanitarian goals don't make it into the boardroom agenda. But I hoped that an idealistic government vision could be joined with the calculations of a financial industry, and we could reach that sweet spot of quality health care for all at a cost we could all accept. And I hoped that our government would retain an ace in our hand in this relationship with the insurance industry, a public option. A public option. So that as we invested our tax dollars and our people's health and our entire economy in a marriage with the insurance industry, we would have a small card to play in the negotiations. Because if the insurance industry wasn't motivated by the humanitarian vision of healthcare for all, if they were motivated as they quite naturally would be by profits, they had two ways to make profits. They could begin the difficult work of health management and cost containment, or if they wanted to maximize their negotiating power with the state of Minnesota, they could do something like this. They could enter the market with extremely low and patently unsustainable rates. And then as the individual mandate took hold and there was no public option with which to compete, they could pull out of markets that were less than profitable, markets like Moorhead and Virginia and Becker and Austin. And then they could raise rates in the individual market to outrageous levels with appalling deductibles so that Minnesotans would demand an answer. And then, standing in full control of the healthcare delivery system in Minnesota, they could return to the government and renegotiate the deal. And a suppliant legislature could write a bill that covers their expensive claims on the backs of taxpayers to the tune of $600 million over 2 years. And this, of course, is where we are in 2017. And what comes next once beaten? What prevents our next beating? Do we leave this round stronger, or as I see it, profoundly humiliated and abjectly helpless for the next round? Members, we can still add a small ace to our hands. It is in our power to add a public option to the market. In communities that have been abandoned by all insurance providers but one, where providers have a de facto monopoly and can set rates at any levels, a public option increases competition by offering a reasonably priced alternative. And we can make the public option small, we can adjust the reimbursement rates so that doctors and hospitals are satisfied, we can do it in any way we choose, and I still think it will be less expensive than what we are doing going forward. We have no guarantees that the $600 million reinsurance bill will lower rates or draw more insurers into the market. We have no guarantees that we won't be writing an even bigger check to insurance companies next year, because we have absolutely no leverage in this transaction. We have absolutely no power over this business deal. Some of you who have been in politics longer than I have, you have made good deals when you were holding a thin hand, and I'm eager to learn your skills. But we are holding nothing. Without a public option, we are at the abject mercy of the insurance industry. I still believe we are strong enough and good enough to ensure health care for all, but even if you don't share that dream or you think I'm naive, I ask you to be a better negotiator for the taxpayers of Minnesota. Be the business people that so many of you already are. Give the people of Minnesota the advantage of a decent hand. I stand in support of the amendment.
Senator Friends.
Thank you very much, Madam President. And I'm sure you remember when you were a freshman senator. I first want to say, I hope I speak for all 21 freshmen in this chamber when I say that we're much less concerned about where we've been and would much prefer to talk about where we're going. I rise in support of the amendment. I come from a district that includes both the city of Mankato and rural Nicollet County, and they have been hit hard in rural Nicollet County by the individual market. I have not had a single person say to me, why can't you put together reinsurance or create a $600 million new program? I've had many say to me, why can't we have a public option? And I ask members to consider, what do we want to be cheering for? We should be cheering for Minnesotans to have access. And I thank Senator Jensen and Senator Klein for addressing what is on most Minnesotans' mind, which is I just want to have a relationship with my doctor, and I think the amendment would do that. Thank you, Madam President.
Senator Hayden.
Well, thank you, Madam President. I raised my hand before such eloquent speeches came in favor of this bill, especially from our really good freshman class. And so I don't think that I could say it much better than them, other than I would continue to say that this is an important amendment. It does the things that we've asked, that Minnesotans have asked us to do. It does start to deal with the reform of the individual market, which is a key component. I heard Dr. Jensen, Senator Jensen say that, and it most certainly gives us the access that we're looking for. So I would urge the body to listen to our newest members. I think they're on the right track and support the Laurie Amendment.
Senator Schoen.
Thank you, Madam President. Well, I rise in support of the Laurie Amendment as well. And I think when we're sitting here tonight looking at the cost to taxpayers in the tune of over $600 million, that this gives us a leg to stand on and tell our neighbors that we are going to deliver something about access. It is going to deliver an opportunity for Minnesotans to have another choice. Minnesota Care, according to the administration, is administered at about a 3% overhead. And we know that we don't have any, we don't know for sure what the for-profit companies will operate at. We don't know, what we do know that we cap our nonprofit companies at 20%, but we're operating at 3%. We're going to spend $600 million of taxpayer money here. Let's have something to give to Minnesotans and the option to make sure, because as Senator Laurie pointed out and Senator Jensen as well, people don't have to drive 150 miles to get to a doctor. We won't have that plan. That network is already in place, and if they want to have the opportunity, it is there with Minnesota Care. Support our neighbors, support our family members and friends all over the state of Minnesota, and give them access to health care in their own neighborhoods.
Senator Abler.
Thank you, Madam President, and I appreciate this debate. It's a really good one. And I want to remind people that those who don't want nostalgia, I'll just remind you that it's still good to learn from history. And there's a reason that people write it down so we remember. And in 2013, I sat with a bipartisan group of people hoping that the MNsure thing would work. I sat there with my name, my credibility, and I said, I hope this can go, but it's all in the details, it's all how it works out. And we were told almost the same discussion. You will save money, you'll have access, and you can have a relationship with the doctor. They said that to us. It's not making up history. And so in today's or yesterday's paper, the Mayo Clinic was reported to have said they're not on an equal basis, with all respect, that money does matter. The Mayo Clinic, with $1 billion or more endowment that is not in risk of going out of business, decided that they were going to have to do a business decision. And if you come in the door and if there's 3 people, you've got a person on medical assistance, a person on Medicare, and a person on private pay, they're going to pick the private pay person, assuming the conditions are equal, which is respectable of the conditions. Now, this bill that we're talking about today is based on Medicare, which is a much better rate than Medicaid, I will admit. However, if the Mayo Clinic cannot live on Medicare rates, how do you think the clinics in greater Minnesota are going to function? Do you think this is the magic answer? Do you think, and by the way, the overhead on these HMOs, which are going to be the same HMOs we don't like running our health plans, are we running this one, their overhead is in excess of 6%, not 3%. And it's very important that we don't just wish for what we could have, but we're stuck with what we have. Is this reinsurance bill perfect? I will say no. Am I happy with the HMOs and the way they've done their work and the way that they've treated us? By no means. But giving them this magic pill, this magic elixir, this magic bullet to run it like they've been doing before is not the answer either. And I will promise, I don't know what the savings will be, but I will know it will not be $422 for a family. It will be some other number. And people will mean well, and we're going to vote what we believe today, and that's a good debate to have. But I want to warn you that history teaches us what is. And what we tried to do in House File 1, or Senate File 1, sorry, was to give some more choices. What if we helped the co-ops come up with some plans and compete? I ran into them today. They are working on some plans. They're becoming a new player. I tried to strengthen county-based purchasing. We still may yet, to able to reach out to some of these areas like Roseau that are very much on my mind. Will for-profits make a difference? Will that put pressure on companies like Blue Cross? I hope so. And so you can't vote for what you hope. You have to vote for what is. And the hand we have is what we're dealing with. And I do know this bill has to go a ways. There's a governor who's going to weigh in. You got a House that's going to weigh in, and this is a process. But if you think by voting for this amendment you are going to somehow solve it all, and that you're going to have access for everybody, I want to tell you that's not true. Already the HMOs that we're so critical of with their access, with their networks, are running these plans as well, and they're starting to limit these networks as well. So I caution you, just because it sounds good, it may not be true, and I am committed as anybody can be in this body to finding a way that works. And in my view, the best way forward is to keep this reinsurance proposal intact, as imperfect as it is yet, and work with the commerce people and others to try to keep our market so it's strong and actually true. Thank you, members.
Senator Jensen.
Thank you, Madam President. I would agree with Senator Abler that it was disturbing to hear that Mr. Noseworthy, the CEO of Mayo Clinic, so sharply commented that if it comes between a medical assistant or a commercial patient, that they would slant their orientation to the commercial patient. I've had many situations in the office where I've tried to get a patient into the Mayo Clinic system, and that's a difficult thing to do. And one of the first questions asked is the insurance question. But that actually, I think, argues the point differently, at least in my mind, than Senator Abler argued it. 3.5 million people almost are in the Twin Cities, 7-county area, which is an area that's excluded in this amendment. We have 2 million people that we're talking about in 80 counties. Those 2 million have been relatively unwanted. And Mr. Noseworthy's comment reinforces that. We don't want that medical assistance patient. We want the Blue Cross one. That's hard to defend. We'll all do better if we all feel dignified. We'll all do better if we all have skin in the game. Those are the kinds of reforms we have to have. Somehow, how do we get everybody pulling the rope in the same direction? How do we get everybody wanting to say, no, if I don't need to have the angiogram, for heaven's sakes, I don't want to have the angiogram? Why is it that almost 75% of people that get a sleep apnea machine, it's collecting dust 9 months later in the closet? It's because we're giving too many of them out. It's because everybody that goes in for a polysomnogram or a sleep test comes out with the diagnosis. We don't have the money to give everybody a motorized scooter just because they want it, and not everybody that has jaw pain should have TMJ surgery. But we need to somehow all pull the rope in the same direction and start to control these costs. And we will not be able to do it if we can't give everybody the dignity that they're valuable and that their pneumonia is going to be treated. Yes, we need to start talking about what benefit sets should be available, and we have to have honest discussion about that. Not everybody needs to have a wig paid for. Maybe if you have lost all your hair because you've had chemotherapy for cancer, yes. But if you're a man and you just lost your hair just through natural causes, you shouldn't necessarily get a wig from your insurance company. These are the things that are driving the cost up. I speak in favor of the amendment.
Senator Benson.
Thank you, Madam President. There's been a lot of talk about market. We know if you watch nationally, once national standards went in for health insurance, we moved to uniformity of product. We moved to uniformity in the market, and that resulted in consolidation. Massive consolidation. The fact that there's been massive consolidation nationwide is proof that consumers were given fewer product choices because of the regulations put in by the ACA. Our market hasn't functioned as a market for a while because insurance companies don't get to actually meet the needs of the people who are trying to buy their product. They have to meet the needs defined by politicians. If we move forward with this amendment, what will ultimately happen, there might be a choice for a little while, but I can't imagine a private entity offering a product to compete with a government product when they don't have a level playing field. There will not be a level playing field. And if this amendment goes on and there's product and the Minnesota Care buy-in option is offered in counties all over the state. There will be no private option offered. I can't say with certainty, but anyone who studied economics or has ever tried to sell something in competition on an unlevel playing field knows there won't be product offered. So there'll be one choice, and it will be the Minnesota Care buy-in choice. And that might be okay for a while, but eventually the individual market will be gone, the small group market will be gone in greater Minnesota, and that will trickle into the metro, and eventually we will have Minnesota Care as the only option. Now, there are people who believe that the Affordable Care Act was put in place so that when things started to collapse, people would blame their doctor and their insurance company, and they would beg politicians to save us. The voter, insurance purchaser, patient, customer would start to beg the government for a government option. And this is where we're at. We now have people begging for the government to rescue us from the damage the government did to an existing market. Because you see, members, there is no panacea. This is not a panacea. The market pre-ACA was not a panacea. The market under the ACA was not a panacea. But if we move to more government in our insurance, we will ultimately end up with less choice. And we will end up with people in this room designing insurance product. We will be designing the insurance product, members. We'll be deciding what Minnesota Care looks like, what the buy-in looks like. I would rather risk decisions being made outside this dome on a much larger scale. As much as I respect all of you members, this is an awfully big deal. And politicians sometimes get things wrong, and so I would rather trust decisions to be made in large part in the homes of Minnesotans with more choice, in the doctor's offices with more options, and Minnesota Care is not going to get us there. And so, with all due respect, members, I would ask you to not walk down this path. I would ask you to take a step back from collapsing the individual market and then collapsing the small group market, because it is foreseeable that that would happen if Minnesota Care were offered this broadly. Thank you, members.
Senator Utke.
Thank you, Madam President. I rise in opposition to this amendment tonight. We've heard a lot of nostalgic comments, and I will back up and do a little bit of that myself. I remember back 4 and 6 years ago when I was not a member of this body, hollering and screaming at the radio and the TV as both at the federal level and state level, you were taking votes on the Affordable Care Act in MNsure and afraid of the disaster that was about to happen. Unfortunately, it was reality. And now today we're here to try and put the pieces back together. And a public version, in my opinion, is definitely not the option. I come from up in the northern part of the state where people don't have options. Some of my people have to travel over 200 miles and drive over 4 hours because of the current in-network options. That is not good, it's not choice, and this amendment would not help that at all. We need to work further on this reinsurance. Like it's been said a number of times, this is another step in the right direction. We've got to get back to where the private market is working for us in this health insurance business. And at that, I would urge a no vote on this amendment.
Senator Pratt.
Thank you, Madam President. I respect Dr. Jensen. He was kind enough to get me a copy of his book, which is available on Amazon for $24.84 if you're interested. But Madam President, I sit here opposed to the amendment. I sit on a long-term care and rehabilitation facility board, and we're constantly talking about how to make ends meet and why. Because the reimbursement rates for Medicare and for medical assistance are so low that we can't pay our staff, we can't retain our staff to help the very people who need assistance. I also met a gentleman tonight from, just by happenstance, from the Farmers Union who was so excited about the new agricultural cooperative health plans. They're already working on them out in greater Minnesota to bring health care to our farmers. They're moving on what we've already done on SF1. They're bringing it to reality, and they're helping to reinstate a private insurance market that we nearly collapsed. And so what do I take from that? And why am I voting against this amendment? Because of my two fears. Of course, I fear that we're not going to have the expected impact on health insurance rates that Senator Schoen wanted to see. But I can strongly believe that we won't see the massive increases that we've seen over the last few years. But here's what I fear. I fear if we put this amendment on, we will drive the final nail in the coffin of the individual market out in greater Minnesota. And I fear that with those lower reimbursement rates, we will put many rural hospitals and clinics in dire financial straits. So members, I urge you to vote against the Laurie amendment. Let's let the cooperatives that we just approved a month and a half ago work. Let's help these farmers like the one I met today who is so excited to get these healthcare cooperatives up and running. Let's give them a chance to get them up and running and stabilize healthcare out in greater Minnesota.
Senator Pratt, may I remind you, just take a look at your rule book on 15.8 on page 12. Senator Friends to the amendment.
Thank you again, Madam President, and thank you, members. I'd just like to pose the question for this body. Are we suggesting to the people of Minnesota that the plan that has the higher reimbursement rates will cost Minnesotans less? I think basic economics would suggest the opposite. Thank you, Madam President.
Further discussion on the A15 amendment, and I'm very impressed that everybody had their books out and found what I was referring to. So you're listening. Further, Senator Laurie to the amendment.
Yeah, Madam President, I'd just like to make one additional pitch for it. You know, when we talk about choice and options, oftentimes it comes at a cost of actually having the real benefits that make sense for people. The essential health benefit set in the Affordable Care Act, guaranteed things that really meant a lot to people that were often excluded from many of the benefits in insurance products, things like maternity care, cancer treatment, diabetes. These have actually been diabetes treatments. These have been called out this year in the body across the street as things that we should maybe make optional. Mental health coverage, chemical dependency coverage, prescription coverage. The suggestion that this would be a bad place to build the product design and that we wouldn't do a good job building a Minnesota Care product is contrasted by 25 years of building an excellent Minnesota Care product that has been wildly valued across the state of Minnesota, particularly in rural where people don't have access today. We need to continue to bring this back to access. We've gotten to a place where insurance companies have orchestrated there's a lot of things at play, but they've made it to a place where they're in a position to pick your doctor, pick your medicine, and pick your pocket. And what we have in front of us here is a $600 million doubling down on a bet that insurance companies are going to step up to the plate and do what they need to do. As contrasted with a 25-year history of the state of Minnesota putting together a good product offering that has the model mental health benefit sets built into it, chemical dependency, all these treatment options that really mean a lot to people. I think we do a good job down here when we say these are the things that people need when they go to see their doctors. And we need to make sure that we have something on the table at least send it into conference committee so that we're able to tee up this access issue. If we go into conference committee without a Minnesota Care buy-in and we have turned over all of the control to the health insurance companies, we will not have been doing a good service to the state of Minnesota. We need some options to be discussing a broader set of concepts focusing on access. And we don't have that if we don't send it into the conference committee, and the Minnesota Senate should bring this in. And I would strongly ask for member support of the A15 amendment.
Secretary will take the roll on the A15 amendment.
It's cool having the counter right away. In the house, you just have to count the dots.
All those senators having voted who desire to vote, the secretary will close the roll. There being 33 ayes and 33 nays, the amendment is not adopted. Further discussion on House File 5.
Third reading. Third reading.
Secretary will give House File 5 its third reading.
House File Number 5, a bill for an act relating to insurance, health, regulating certain data practices of the premium subsidy program.
Third reading.
Madam President.
Further discussion. Senator Marty.
Thank you, Madam President. And I'm disappointed. It's frustrating to lose 33-33 on an amendment. Senator Laurie, I appreciate what you've tried to do. As of this bill, we will now have put in close to $1 billion in one session in an attempt to temporarily, for a 2-year period, to temporarily fix a portion of the insurance system, health insurance, for 5% or less of the Minnesota population. Without Senator Laurie's amendment, I don't think we're going to have any guarantees. As Mr. Dames has said, we don't have any guarantees that people in every county are going to even have a plan that they can purchase if they can afford it. And even with all of this, all of that $900 million is trying to address it for 5%, and it does nothing for anybody else. I would argue it may not do much for that 5%, but it certainly doesn't do anything else for the other 95% who I frankly think most of us hear from a lot of those other 95% about lack of coverage for dental care, for long-term care, for prescription drugs, the concerns about tight networks and ever tighter networks, and prior authorization, and higher premiums, and higher and higher and higher copays and deductibles. And I think we have to get to the point that we are barking up the wrong tree, perhaps. This is not meant to attack insurance companies, but all the discussion here, and Senator Benson and others are talking about, we got to make sure we have an insurance market. I think what we should be making sure is that people have health care. And having insurance is not the same thing as health care. Is any one of your constituents who may have health insurance but can't afford any of it, I mean, we're not getting any closer to it, and we are now putting in almost $1 billion this year in that temporary attempt to fix it for one small portion of it. So I would argue, and I think it's worth pointing out, because I think 2 years from now we're going to be back again trying to fix it again, that we start looking at other alternatives and start looking at health care instead of health insurance, because they're not the same thing. I'll urge committee to look at Senate File 219, our proposed Minnesota health plan. And when people talk, everybody throws out this about government control of health care. I don't want government control of health care. I don't want insurance company control of health care. I kind of think should be what I think Senator Benson said a few minutes ago about politicians often make wrong decisions. She'd rather have the decisions in the hand of individuals and families and their doctors. And that's where it ought to be. Our proposal doesn't have a government plan. It's not an insurance plan. Who gets to choose the doctor? You do. No networks. We didn't have networks many years ago. Most countries don't have networks. You can go to the doctor you want to go to. We don't need networks. People should be able to make the decision. And I read Senator Jensen's book, and I think it's great too. He talks about the importance of doctor-patient relationships. And who should make medical decisions? Who should ration care? I don't think it should be government. I don't think it should be insurance companies. I think it should be patients and their doctors. And we could develop a plan like that. Senate File 219, I think, is one that would accomplish that. I think we ought to take a look at it. It's the only proposal that's going to touch not 5%, but 100%. Cover everyone. You don't have to fight to get the same plan next year. You don't have to worry about what's covered and what's not covered, because dental care and everything else, it is pretty important. Pretty important to health care. We don't have to fight over those things. We ought to cover it. And I know there are lots of people who are, well, this is a significant change from the way we do things. But we've spent 30, 40 years trying to bring down the cost of health care by making it more difficult for people to get access to care. The whole HMO thing, the networks, the prior authorization and more prior authorization, co-pays and deductibles. Everything's designed to make sure people don't overuse health care. And we have restricted how much health care people use. And we're still spending twice what anybody else in the world, with 2 or 3 exceptions, spend. Twice as much. So I think we got to get to, it raises 2 real questions we ought to answer. One of which is, what kind of a society wants to make it difficult for its own people to get health care? I can picture we want to make it more difficult for some enemy country or something to get health care. But why do we want our own people to have trouble getting access to health care? Why do we do that? And frankly, after 40 years of trying to save money by making it harder for people to get health care, if we're spending twice what anybody else spends, maybe it's not a good strategy economically either. So I just urge us to, I think this is a lot of money going for something that gets no guarantee of any change. I think we would have had some positive things there. I don't think it would solve it, but Senator Lori's thing would at least have given people an option for the next couple of years. So I urge people to, one, I'm not going to support the bill. I don't think it's a good use of taxpayer money. But I also think we got to take a look and stop thinking about trying to preserve some insurance market when we ought to be talking about providing health care for everyone, because there is a huge difference and we got to recognize that. Thank you.
Senator Simonson.
So you can't raise taxes and be president with the taxpayers. So he got $60 billion in 10 years that we gave him. His hands were so he got to spend it. And the people that were asking me so much, they went to the ribbon cuttings of their bridge.
We have a fundamentally broken system and a fundamentally broken microphone. My concern, and I get up because I want to talk about this bill, but I have tried really hard to avoid healthcare committees in my short time in the legislature, because I think it's to quote Senator Lori, who said not too many days ago that healthcare is incredibly complicated, and the policy surrounding it is incredibly complex. And I listened to the debate very closely tonight because I have to go back and answer to my constituents. And I have to tell them about what I hear here on the floor because I don't have the opportunity to hear what's happening in committee all the time. And my constituents are coming to me and saying, we elected you to solve a problem, solve a whole host of problems, really. But this is on people's minds every day. We are approaching, if we pass this bill, signed into law, we're going to be approaching investing nearly $1 billion this session in putting a short-term Band-Aid on a healthcare system that's fundamentally broken. We are missing an opportunity. Senator Marty got up and talked about the Minnesota Health Plan, Senate File 219, which I support. And I think we are nearing that time where we have to have a serious discussion about what healthcare in Minnesota looks like as we go forward. None of us in here can control what happens at the federal level. We understand that. But I think we can have a firm grasp about what's happening here in Minnesota. And it's time to have a serious discussion. Senator Laurie tried to offer an option that would build us a bridge. It would have been a temporary fix. It would have built us a bridge to get from here to somewhere into the future where we can have a serious discussion about what actually needs to happen here in Minnesota in the healthcare system. And we voted it down on almost a partisan basis. A lot of respect for Senator Jensen and what he did here tonight. But we voted it down. So we don't have that in front of us. So we don't even have the opportunity to create a path to having a serious discussion about real solutions. So I ask you, I don't know what you're hearing, but what I hear from my constituents is really simple stuff. They don't want to get deep in the weeds on the policy. Here's what they say. They say, you know what? Healthcare has become unaffordable. My premiums are too high. And I say, well, we're working on things. We're going to try to bring down the cost of premiums, at least in 2017. They say, it doesn't matter. What good does it do to reduce the premium if I can't afford the copay and the deductible? I still have that problem facing me. This bill doesn't fix that. It is still going to be unaffordable health care. They talk about lack of access, especially when I go out into more rural areas of the state. You've heard it talked about here tonight. Distance to travel to get to a provider. It's unacceptable. It's 2017. And we've got people that are traveling 1 to 2 hours away from their homes to get access to health care. This bill does not fix that problem. There is no guarantee in this bill that will fix that problem. Our emergency rooms are overridden. I told you I avoid healthcare committees, but I have spent a career in public safety. And for the last 27 years, I have spent many shifts responding to incidents where people need help, and I'm happy to do that. But I will tell you this, from the time that I started 27 years ago, we have seen an 800% increase in emergency medical calls. If you want to understand what's causing the problem with healthcare, if you want to understand what's driving up the cost of healthcare, go to the emergency room and spend a few hours. You all have the opportunity to work alongside 2 excellent physicians that will tell you these very same stories. But I can tell you it from the street perspective. An 800% increase in 27 years. From 2,000 a year to 16,000. There is the problem. We have people using the emergency room to deal with dental problems, drug abuse, mental health problems. If you really seriously want to take a look at what's causing the problem, look there. Fix those problems. And then we can start to have real conversations about access and lowering the cost of health care. Members, I have to go back and I have to say, look, here's what we did. We put a Band-Aid on. And it's not even a Band-Aid that begins to scratch the surface. I would encourage us to not make health care a partisan issue anymore. We've got all kinds of things we can argue about on a partisan basis, but Minnesotans, they just want to get health care. They want access. They want to be able to go to their small-town clinic, small-town provider. They want to be able to go to the dentist. You got people on assistance that are waiting 18 to 24 months to see a dentist. You can't do that. It's 2017. We live in the United States of America, and we have people that can't get access to a dentist. There's something drastically wrong.
Senator Jensen.
Thank you, Madam President. Yesterday, I had two people come in the office here at the Senate and talk to me about what had happened. One was an insurance agent, and he told me I could go ahead and tell the story. But basically, he told about two patients that had been encouraged to move from medical assistance to the individual market because they could qualify for that. And essentially what happened was medical bills of $140,000 were shifted from medical assistance to the individual market. The people that are unfortunate enough to find themselves in that 3% of the Minnesota population that makes up the individual market do need help. I speak in support of this bill very passionately. I think this bill intersects very nicely with Senator Lori's amendment. I support both of those things. But I do think we need reinsurance so that we're not spending the next 9 months talking about this. This reinsurance piece, if you'll notice, is basically taking us 2 years forward so that we can have those discussions, Senator Simonson, that we need to have. And you said it more eloquently than I can. Thank you. I think reinsurance is important. There's a variety of ways to do it. I've never heard so much positive accolades for MCHA until it was gone. Because when MCHA was around, physicians hated it and a lot of other people did as well. But once we saw what we didn't have, we started to say, gee whiz, that was pretty effective. So we need something to move forward. We need something to go to conference committee. We need the conference committee to work its tail off to try to say, okay, let's talk about this actual healthcare cost piece. In the 1970s, when I first started my medical career, 5% of the gross national product approximately went towards healthcare. We wondered if we would ever hit double digits. Well, folks, we're almost up to 20. We've tripled the amount that goes towards healthcare. That's because we have more procedures and the price tags associated with them multiplied give you your number. $10,000 per person in America. So we need to fix a problem, and we've got lots more work to do, and frankly, here in the Senate, we're burning daylight. So I think we should support reinsurance, get this moved on to conference committee, and get on to other problems. Thank you.
Senator Cohen.
Madam President, thank you. Let me for just a minute offer a different perspective. I appreciate what Senator Dames has done. I listened to him not only this evening, but in the Senate Finance Committee. But I want to offer a couple of comments. I'll be a little bit of a broken record after our last health care bill. And I know how difficult it is to put together the state budget. I know what Senator Rosen is wrestling with. The budget's the ultimate square peg in the round hole. But I'm afraid this is the wrong way. If we listen to both Senator Simonson and Senator Jensen in terms of what happens in the future, members ought to keep in mind that this bill is funded through the Healthcare Access Fund, I believe $360 million, and for the budget reserve of $240 million. Those are both pots of one-time money. That means at the conclusion of the 2-year period, we have no idea where the money is going to come from that then will continue this program. If I have a criticism of this legislature having served over the years, and this is directed to both caucuses, this is directed toward myself, it's that we look at only the short term. We don't look at the long term. And in this particular instance, coupled with the bill we had passed previously, authored by Senator Benson, we are spending approximately $1 billion in one-time money for a quick fix over the next 2 years without any idea as to where the money will come from subsequent to that. Members who have served during the decade of deficits know how difficult it was to put together a budget and the displacement that took place. If members have listened to the economist, to the state economist, in presentation of the budget forecast, if members have had a chance to listen to the Council of Economic Advisors, or at least read what they've had to say, if people have read what's come out of national economists, 2017 looks like a very good year, potentially, or a decent year. 2018, however, it's suggested we'll see some type of a slowdown, absent something unusual. If that happens, and there's more of a chance of that happening than not happening, we'll find ourselves in 2 years having no idea as to where we go for money to continue this program. It's a real danger, Madam President and members, when we put together a budget based upon one-time money. It's one thing, we heard Senator Senjum's bonding bill in the Finance Committee, and he used money out of the general fund on a one-time basis. But a bonding bill, a capital investment bill, is a one-time bill. This is not a one-time bill. It's not meant to be a one-time bill unless we assume magically that Washington or someplace else is going to take care of this healthcare crisis. That being the case, whoever is here in 2 years is going to find themselves having to search and dig for that money and having no place to go. We will have held out a false hope to Minnesotans that we've solved the problem, and instead in 2 years we will compound the problem. So I'd ask members to think not so much about tonight or tomorrow or next week, but what happens to folks who come to depend on what we do tonight, what might possibly pass this legislature, and where that takes us down the road. Putting together a budget of this scale with one-time money is a fiscal problem. It's a problem that will potentially be reflected by the bond houses as they look on what Minnesota has done using one-time money for ongoing spending. And we'll find ourselves at some point, not tonight, not next week, not next month, but sometime down the road, we'll look at ourselves and we'll have regrets with what we're doing tonight.
Senator Kiffmeyer.
Thank you, Madam Chair and members. So I've been listening to the debate quite patiently here, and it just kind of amazes me, after having sat on the Senate floor for 4 years, to now hear the same people talking about this situation that we have in Minnesota as if they had nothing to do with it. You know, it is important to remember that the very architect of the implementation of Obamacare in Minnesota, called MNsure, was Senator Laurie. He was very proud of that MNsure implementation. Matter of fact, there was the main conference room named after Senator Tony Laurie Conference Room. And so it is a creature and a creation of that. Obamacare is MNsure in Minnesota. That is the reality of why we are here today. This disaster didn't just magically happen and there was a situation beyond our control. It was a control. It was a decision. It was a conscious decision that I and many others absolutely opposed as fundamentally and fatally flawed in its inception. And now here we are today. It has come home to us today. So here we are trying to work hard to take care of our Minnesotans. Our Minnesotans who, through Senate File 1, recognized the horrible pain that they've gone through. Bankruptcies, not being able to get their cancer treatment, many other issues that we all heard about, how easily it is that we forget last fall, and all the emails and all the pain that folks went through. And Senate File 1 was our measure of saying we have to at least stop and take care of our Minnesotans first and foremost, and just how important that is. Now, granted, right now we're looking at the same program we had before Obamacare and MNsure swept it away, the Minnesota Comprehensive Health Association for high-risk Minnesotans who need help. And so we put in place that before. But Obamacare MNsure swept that all away. And here we are now putting back in place something that was not only working in Minnesota, though imperfect it may be, it was working. And matter of fact, today it's being talked about, a high-risk pool reinsurance program on the national. And Minnesota's looked upon once again as a leader. And here we are as leaders working to put the Minnesota Comprehensive Health Association reinsurance high-risk pool in Minnesota. This is an approach that amazes me is criticized when we already had this in Minnesota. Our Minnesotans, they look at this and say, you are discussing and maybe disagreeing about how it's paid for. Well, meantime, our Minnesotans out there, they were absolutely terrified last fall of the premiums and the increases and the destruction that was coming upon their families in that disaster in the individual private marketplace. And so here we are today saying they're going to be absolutely terrified if we don't do something like this, because we'll be right back here next fall if we don't, having another discussion. The one thing we can give them is a hope and the opportunity to take a tried program, Minnesota Comprehensive Health Association program, and one that we already know about because it has been used in Minnesota, and put this in place to at least give them that they can look to that through the rest of this year. Is it short term? Maybe it is. But to those folks, that's pretty good. That gives them hope. Meantime, the federal, our state, and others, as we work together, and some other reforms that are put in place, will begin to have their effect as well. So members, I encourage you, vote yes for this bill. Vote yes for Minnesotans. Thank you.
Senator Schoen.
Thank you, Madam President. Well, that was interesting. You know, this legislation isn't helping ensure coverage in greater Minnesota, where insurance companies with billions of dollars in reserves abandon Minnesotans. This legislation takes money designed to help the poor and the sickest and hands it over with no assurances to those companies. The author himself said, we're spending $600 million. We're not sure it's going to work. I know when I tell my mom, if I had $600 million, and I said, well, I want to do this, but I'm not sure it's going to work, I know what the answer would have been. You know, it's like driving a car down a gravel road with no lights on and hoping you're going to get there and not hit anything. And there's a lot of obstacles. But I got to say, you know, took a pretty good, Senator Laurie took a pretty good jab there, I guess. But, you know, Senator Laurie and those of us that were in the majority at that time were left with a mess from inaction. We didn't have a whole lot of time to try to put a plan together which did deliver the cheapest rates in the nation under a plan that was sent to us from the federal government. But as Senator Frentz said, we do need to look forward. And I'll tell you, if we're going to be leaders, leaders don't put $600 million in cash in a minivan out in front of the Capitol and watch it drive away unguarded and unprotected, and that's what's happening in this bill. Vote no.
Senator Hoffman.
Thank you, Madam President, and well said comments today. And I'm sitting here, and I have a few questions that I think we should ponder or consider when we talk about health insurance and coverage, and specifically reinsurance. And from the face, reinsurance really looks like a government bailout and a corporate handout, and that pours the hundreds of millions of dollars of what we see into those health insurance industry, which we know we question their lack of transparency and accountability. So the question there is, how are we going to assure some accountability and some transparency? I'm not seeing that, Madam President. So I have concerns. I think my friends are on the right track about doing something, and what the something is, I think hasn't been vetted long enough. I think the fast track this past year, specifically our first session back, is really getting to, cautions us. And it should caution us, because if you're not cautioned about some of these questions that I'm going to raise, which is, we don't know how much reinsurance will lower premium costs. We don't know. The health insurance industry, I know, testified in the other body, Madam President, and they cannot guarantee, and that's what they said, they can't guarantee a reduce in premiums. Madam President and members, reinsurance will do nothing to rein in those runaway deductibles. I know what that looks like, and do a lot of people that live within my community. Madam President and members, more and more people on the individual market are facing deductibles that are in the thousands of dollars. And unfortunately, these policies that I'm seeing and I'm hearing tonight really are going to amount to some catastrophic coverage or junk insurance. Reinsurance is not going to do anything to rein in those deductibles. Reinsurance will do nothing, Madam President, to solve the problems of patients' access to providers of their choice. And Madam President and members, reinsurance will do nothing to guarantee access to insurance, because, you know, as we heard tonight, the amendment that was brought forward was a good amendment, and unfortunately some parts of rural Minnesota are going to have zero options to them. Diverting tax money from the Healthcare Access Fund, which is meant to provide access to health care for low-income Minnesotans, is especially unwise. members, because given the federal uncertainty for health care funding and the real danger of caps on Medicaid. So in a sense, what I'm hearing tonight is reinsurance is kind of a pig in a poke. And I caution us, because unless we have a full understanding of the impact of funding and structure and implications, it's a giant government program that we're going to create that would offload the risk from insurance companies onto the tax-paying public. And if that's what we're about, Madam President, I think that's, in one words of a teacher I had in school who was a member of the other body at one time and served as assistant secretary, he would say that's not a good move. And I would hope that we don't look at this, that we continue, because it's not a good move and this is not good policy for Minnesota. So I would suggest we vote no.
Senator Nelson.
Thank you, Madam President. Well, I don't like where we are today either. We are left with very difficult choices. And we all agree in this room, I believe, with the diagnosis. Our health insurance system is broken. It's broken to the point where you can just Google health insurance plans leaving Minnesota, and you'll see 10 articles about Medica, about insurance companies choosing not to even offer products in our state anymore. We heard about patients who had to drive by clinics that they'd like to go to because they're not covered, and they had to drive further to get to something that was in these very narrow networks. Well, these are difficult choices. It broke my heart as I heard over and over from farmers in my district and small business owners in my district who were facing $40,000 in premiums a year. And not just a $1,000 deductible, no, these were $13,000 deductibles for a husband and a wife. These things are unacceptable and untenable. And no, I don't like where we are today. These are hard choices. The Healthcare Access Fund is something that we want to preserve, and yet we are left with difficult choices. And yet, from all of those who have said that they are not going to vote for this bill tonight, the only thing that I've heard as an option, and there was a long discussion about it, was the Minnesota Care Buy-In Program. Well, that's another one of those things that sounds good, but in reality, it would lead to fewer choices. There's one thing that Minnesotans and I think Americans have learned in the last 10 years, and that is that when the government steps in and starts to run and manipulate insurance companies, it doesn't turn out well. And so what we have before us tonight were two different prescriptions for the same problem. And what I have heard from my constituents over and over is they do not believe that another government-manipulated, artificially induced health insurance program is going to work. This is tough medicine we have to take tonight. We have to swallow it. We need to do what is right to at least save the options for Minnesotans to purchase health insurance, to be able to go to the doctors that they choose. The other prescriptions that we have heard will only reduce the options, will only reduce the providers, and the way that the government would hold down premiums is by holding down reimbursement rates. Well, we've already seen that. We've already seen what happens when there is that artificially holding down of those premiums. So I would say we have to buck up. We got to swallow the bitter medicine tonight. We have to move forward. My constituents don't like it when we continue to point fingers at one another. They are asking us to get something done.
Senator Dibble.
Thank you, Madam President and members. I can hardly believe my ears that we're being asked here to devote up to $1 billion in order to prop up some insurance companies with no assurance and no guarantee that we're actually going to get anything. And we know for a fact that we're only buying a fix that's going to last for a couple of years. Meanwhile, an option that was offered is being derided as unworkable. We know what's not workable. What we've got in keeping these insurance companies at the center of everything is unworkable. That's been shown. Members, remember, the Affordable Care Act was an idea that was first developed by the Heritage Foundation. And every conservative in the country thought it was the best idea they ever had because it created a free market exchange, keeping private insurance companies at the center of our healthcare system. Not doctors, not patients, not the actual delivery of healthcare. All of this that we're talking about is designed to prop up insurance companies, the middle player. This isn't about healthcare. It's not about doctors and access and relationships. It's about corporate bureaucracies. It was anticipated that very likely this particular market may not be priced well, and it wasn't priced well in Minnesota, certainly with the extremely low premiums that came in initially, although everyone was really happy about that. But it was anticipated at the federal level, and so what's so-called risk corridor payments were authorized. Immediately jumped on by a candidate for President Marco Rubio as corporate welfare, as a bailout of corporations, and reversed by a Republican Congress subsequent to passage of the Affordable Care Act. So in Minnesota, we anticipated, because the risk pool wasn't as broad as had been anticipated, we anticipated that there would be a premium increase that was fairly dramatic, and a number of options were offered to resolve that before it even happened. And then it happened. Senator Laurie offered 5 or 6, along with the Democrats on the committee at the time, offered 5 or 6 alternatives to help address and get out ahead of this, what actually did happen. And so we got all of the emails and all of the pleas for attention, contemplated a special session, dealt with it in the first few weeks of session of this year, all designed to prop up and bail out these insurance companies. And now we're just doubling down, spending up to $1 billion, stealing dollars out of the Healthcare Access Fund, a crucial source to provide funding for critical access healthcare needs, taking money right out of the Healthcare Access Fund to pay for healthcare for those who are at the margins, who need it the most, in order to maybe get some sort of resolution to the premiums that we're experiencing in the individual small market. Maybe taking $240 million out of the budget reserves. We heard Senator Cohen's analysis of that, where that's going to get us in a few years. Applying for a waiver from the federal government. We have no idea whether or not we're going to get that. So I think Senator Hoffman said it best. We're buying a pig in a poke here. We're trying to prop up a system that we know is not working and rejecting an option that works very, very well in every other modern and advanced economy. I don't know why we think we're so special. Senator Marty hits the nail on the head. We need to stop having this conversation and start talking about actually delivering health care to people who need it.
Senator Isaacson.
Thank you, Madam President. The other day I had a group in and they asked me, what did I like the best about the legislature? And I said, moments like this where I get to talk to you. And they said, so what do you hate most about the legislature? And I'm like, well, if you got some time, I'd like to tell you some stories. And one of the things I said that I think I dislike the most is intellectual dishonesty. And intellectual dishonesty is defined as a failure to apply standards of rational evaluation that one's usually aware of that seems to ignore the current reality for a self-serving purpose. And I have heard several arguments like that today, and that's really the crux of what I dislike about politics in Minnesota, or maybe just politics in general. I hear people talk about how the ACA and MNsure have wrecked our state for health insurance, and it's like you're living in a fantasy land that 2012 and earlier never happened. I just don't even understand how a person can make a comment like that and pretend like any time before 2012 didn't exist. That doesn't even make sense to me. We have a problem with rising premiums. That's been going on for years. That didn't just start. If anything, because we had to be the adults in the room and make a decision based on what the federal government handed us, we were able to save our constituents, our citizens, thousands of dollars compared to what happened just next door in Wisconsin when people were under the federal plan. So I really struggle with this level of intellectual dishonesty, to pretend like things are a certain way because it fits a narrative rather than what the reality is. We're going to spend $240 million out of the reserve fund. I could think of 10 ways I'm sure my citizens would be interested in hearing how we could spend that money on lowering tuition costs, taking care of the homeless. There's 7,000 homeless kids a night, but we're going to hand off $600 million to an insurance company? Are you kidding me? I just don't get the logic behind that. I think that we have options in front of us that look for long-term solutions rather than just handing money out right now to the corporate interest, the insurance interest, rather than taking care of the people in our state that are actually in need. I heard the comments of people talking about how much people were hurting just a few months ago, and you're right. There were parts of 5% of our population that were in a lot of trouble, and we have a responsibility to help those people when the market goes awry. That's what the government does. But to think and act like the whole state's in some sort of turmoil, that's just disingenuous. And it's irresponsible to the people that watch this and pay attention to what we do. I struggle with this idea that because the Democrats stood up and took a swing at the plate to try to solve our health care problem, now because it didn't hit a home run, they're to blame for the reason why we have health care problems. That just simply isn't true. The Democrats took a swing and made a couple of good points, and a couple things didn't work out the way I'd hoped. There's no doubt about that. But the reality is they were making an effort. You want to Google something interesting, Google Republican health plan before 2012. Crickets. That's all you're going to hear is crickets. So I would appreciate not having to listen to the self-righteousness of people that want to come in here and lecture me about how we hurt Minnesotans when they weren't even paying attention until we made it an issue.
Madam
that
President.
struggles me. So I appreciate that's all I have to say. Thank you.
Senator Nelson, for what purpose do you rise?
I would ask the President to refer the member just speaking to Section 124 in Mason's. Personalities not permitted in debate. We hear remarks should be confined to the question before the House, avoid personalities. We've continued to hear words like disingenuous. I would encourage discussion on the issue without talking about irrationality, disingenuous, or motive, Madam President.
And Senator Nelson, thank you very much for the reminder. We will just, please, everyone take it under advisement. Senator Isaacson.
I think that being that we're all adults here and I'm trying to have a policy discussion and talk about the veracity of some of the statements we're making, it's important that we call out what we think is true and not true. And that's all I was doing.
Senator
and
Isaacson,
I didn't call
it was
for
simply a gentle reminder.
Thank you. And I just want to point out that I never said any particular person.
Senator Isaacson.
Okay. So I think you're right. There are difficult choices, and I think we've got some opportunities, and I think we're passing up a big one right now in order to make some, I think, poor healthcare choices that not only are we going to have to fix now, but 2 years from now, we're going to have to go back and refix, and we're going to have this argument all over again. And there we go, kicking it down the can down the road, and that is exactly why Minnesotans are tired of Minnesota politics. Thank you.
Senator Benson.
Thank you, Madam President. There were some comments made about Republicans ignoring health care prior to 2012. I think the members who served in this body prior to the implementation of Obamacare would remember Minnesota Care was very bipartisan. And so I don't think there was ignoring. I think that when the federal government came in, it disrupted something that wasn't perfect, but it was ours, and we worked on it. And so now to my actual comments. Senator Dames was reelected into the majority with a market that was collapsing, and that required some action. And we've talked about healthcare being costly and complicated. And the question remains, how do we deal with the cost? How do we provide stability to our complicated critical infrastructure? In my opinion, a public plan both masks the cost and, if you look at the payer mix for our hospitals, undermines some of the stability for our critical healthcare infrastructure. Senator Dames is working very closely with the Department of Commerce, their counterparts at the federal level, to find workable options in a very short time frame. Something that can stabilize our market, something that can be trusted by the people who will have to design health plans. This is not easy. There's no straightforward path and there's no promises being made. But I have to commend him for not ignoring this problem, hoping it goes away, pretending the feds might solve it or something will just work out. He has undertaken a very hard task. And so I want to thank you, Senator Dames, for your straightforward bill, working on a problem that was not of your making. But I also want to thank you for not making promises that you don't believe you can keep. The fiscal note says a potential impact of 21 to 23%. That's not a promise that rates will go down. It's the best assessment that the best people we have available have made. Members, we are in unprecedented change, and we are doing our very best to make good choices, moving as quickly as we need to impact the market for 2018. And so I appreciate those members who will vote yes. I certainly understand those members who will vote no. But there is nothing being hidden. There is nothing misleading about what Senator Dames is doing. He has been very straightforward and presented everything he knows so that we can make the best informed decision about what our market could look like going forward.
Senator Hayden.
Well, thank you, Madam President. And I do want to thank Senator Dames for bringing forward this bill, and also Senator Benson, who I know that has been instrumental, and Senator Lori, and kind of the healthcare team that has really vetted that. And I know that I have been pretty tough on Senator Dames. I certainly have asked him a lot of questions throughout this process, and he has been a trooper to answer those questions the best that he can. But that's what we do in the Minnesota Senate, is we vet these proposals. We ask those questions because we want the best for our citizens. I do, for nostalgia's sake, and I think that Senator Dibble and Senator Marty have talked a little bit about it, but for nostalgia's sake, because I think that we romanticize history maybe a little too much, and we certainly, and I know I've been accused of it as being revising it a tad bit. But we did, as we started to do any big legislation, we started to try to figure out how to implement the ACA and provisions of it. We started out with expanding Medicaid. But when I was here during those times and the GOP just happened to be in control, we weren't able to figure out what to do with an exchange. We weren't able to get a hearing on a bill to try to put an exchange together in a timely manner. And then when the Democrats took control, we were pressed in the action, and we had to figure out how to put this together. And you know what? It didn't work as well as it should have. I'd be the first to say it. I know Senator Lori and others, and you guys will quickly point that out. But it was the best that we had to do under the time frame in which we had, and I think that's what Senator Isakson was referring to. But we put it together as best we can, and we started to walk through that process, and it was bumpy and rocky, but we continued to fight and get through it. Then we got to a point where we started to understand that there was going to be problems in the individual market. Senator Dibble referred to the issues that Senator Rubio in Washington and others through in the continuing resolution battle took the money out that was for this very issue here. The money left from Washington, and we knew that there was going to be a problem, so the Health Care Committee Senator Lori's committee, led by Senator Lori and Senator Sharon, we put together a series of proposals to deal with this very issue last year. We brought it to the conference committee, and the folks in the House, the GOP-led healthcare of the House, didn't even want to hear about this issue, didn't adopt a single issue, and didn't want to hear it. So we did our best as we did, and Senator Lori's lead, we were able to get through and close up this bill and move forward. And then we moved into the summer, and things progressively got worse and worse and worse until the plans pulled out of the individual market. And then at that point, we really pushed the panic button and we got worried. And then bipartisanly and bicamerally, we came together to try to figure out what we should do. Should we resurrect these ideas? Should we do the public option? Should we do a reinsurance plan? September, nobody wanted to make a decision, right? Even though we brought those same things, we didn't want to do it. October, November came, and we thought, okay, well, the election will happen, something will happen, there'll be winners and losers. Well, guess what? We're in the minority, but we still got together, and they didn't want this to happen. So on and so forth, and we get to January, and then we're in a mad rush. We got to get something done. Oh my God, what happened here? We got to get this stuff out to Minnesotans. They're hurting. Their premiums are going to go up. They're not going to have the access that we want. So we got to do something, so we did. Now we're at this point. That was $300 million ago. Now we're $600 million. And we said this is the best that we could do because we're under a time crunch. Members, this bill doesn't give you the things that everybody says that it does. Senator Kiffmeyer spoke so eloquently and passionately about her constituents that need the reform, that need the access, that needs the treatment for cancer. This bill doesn't guarantee that, Senator. Madam President, this bill doesn't guarantee that. This bill does not give you the reforms, Dr. Jensen, that we're looking for. It certainly doesn't give you the access, and I really do appreciate the vote today to do something in a bipartisan fashion to try to figure this out. We don't know what's going to happen with the federal reimbursements. We're hoping, we're praying, we're going to kind of pray to Washington. We hope that a 1332 waiver is even something that they'll take a look at, because the last that we looked, the Affordable Care Act was going away, and we had the new act, whatever that's called, the Trump Care or the Americans for I don't know what it's called, but whatever it is, it's not the Affordable Care Act. So we don't know if that's going to work, but what we do know is that we have a $1.65 billion surplus, 1.65 with a B. And we're going to come out with targets soon, and we're going to say where we're going to spend that money. And for some reason, my friends to the right don't want to take a piece of that money and give it to Minnesotans for their health care. Somehow they want to take money that has been slated historically for the working poor and low-income Minnesotans, and they want to transfer that money to those that are dealing with this issue of reinsurance, this 2.5% of people that is at 400% or above the poverty standard. We want to give that to them. We want to go into the reserves. Senator Cohen talked about the group of economic advisors. I've been trying to find that meeting since I've been in the legislature, but Senator Cohen knows where that meeting is, and he goes religiously, and I believe him when he says that there's some things that are going on. But we want to take the money out the reserves and risk our future, rob our piggy bank, potentially risk our bond rating to do this work. Though, members, we have a $1.65 billion surplus. If this is what we want to do, why don't we take the money there? Senator Abler talked about the most vulnerable people. I serve as the lead Democrat in his committee. We've worked together. I've worked with people like Senator Hoffman and others to work on this issue. Why would we take money away from things that we need in that division and put it there when we have a $1.65 billion surplus? This is a public program. This is essentially a welfare program for the plans. We have decided that that's who our most vulnerable group is in Minnesota, is the health insurance companies. I don't think that that's where we should do it. If we do this, we should take it out of the money that we have at hand. We should forecast that, and then we should adjust our budgets there, but somehow there's no appetite for that. There's absolutely no appetite for that. So, you know, everybody kind of was talking about that pig in a poke. And so I'm from an urban area. I have no idea what that means. So I had to look it up. It said a pig in a poke means something that's sold or bought without the buyer knowing its true nature, value, especially when buying without inspecting it beforehand. Members, that's what we got here, is a pig in a poke.
Senator Laurie.
Thank you, Madam President. I know the hour is getting late. I'm going to try to be non-repetitive here, but there are a few things that I'd like to mention that I don't think have really been talked about yet. First off, I'm just going to step briefly through the path that the reinsurance concept has taken thus far in the Minnesota Senate. I will reiterate again, I actually do think reinsurance is a valuable tool to use in stabilizing an insurance marketplace, but it has to be done right. And it's important to kind of it's instructive to look at the path that this has taken. It first showed up as an amendment, I think, on Senate File 1 with an MSHA-like assessment that Senator Marty offered as our first amendment tonight. You know, that got significant pushback from the Chamber of Commerce and the health insurers and NFIB, and like a day later in Finance Committee, that was stripped and it was turned over to a $150 million one-time appropriation from the general fund. I believe that's how we sent it into Conference Committee. It was then removed in Conference Committee. It came back in this Senate File 270, I think it is, or House File 5 that we have before us, originally funded through a new tax, not the MSHA assessment as it was, but a new tax similar to the provider tax and a corresponding reduction to the provider tax. That got a lot of pushback because the tax implications weren't fully vetted and there didn't appear to be a plan to vet them through the tax committee. And so then at the next stop in HHS, the tax implications were stripped out of it, and it was replaced with $180 million of healthcare access fund in each of 18 and 19. So for a $360 million from the healthcare access fund, there were significant questions asked about the contingency and whether $180 million in a year was actually going to cover a $300 million reinsurance program. And it was said, well, the feds are going to step in and we're going to get this, this waiver. And that's going to be the balance of the $300 million per year. And those questions were thought about for a day or two, and then it came into the Finance Committee, and we added another $120 million to sort of offset the contingency that the feds don't give us a waiver, an Obamacare waiver, to accomplish what is being attempted here. These are each really major shifts in how we approach and how we fund a reinsurance model at every stop along the way that made it incredibly hard to track through the process. And we really need a strong Senate position going into Conference Committee. It's one of the things that, you know, I think troubles us if we don't have our ducks in a row, and I really worry what might come out of Conference Committee. I hope that we come out with something that can work. You know, the Healthcare Access Fund, the way it's structured right now, taking this money out of the Healthcare Access Fund of $360 million, when there was a funding mechanism, again, offered by Senator Marty, this is not our old MSHA. MSHA, a key part of its structure and the way that it functioned was by assessing the health insurance carriers for the program that subsidized the high risk, focused on one narrow part of the broader, fully insured marketplace. And putting our reserves at risk at another $240 million, Senator Cohen really kind of described that. The piece that I wanted to get to, though, is this idea about the federal waiver that is contemplated in this bill. And, you know, at each of the stops, I was asking, because without the waiver, if we put money, state money, into our individual health insurance marketplace to buy down premiums, and we're going it alone, it foregoes federal money that is designated to flow to Minnesota to buy down premiums and to support our Minnesota Care program. And so I continually ask, what is the loss of federal revenue that we are risking if we don't get this waiver? And the fiscal note spells out pretty clearly that at this $300 million a year level, $600 million total investment in a 2-year version of this reinsurance product, we stand to lose $300 million of federal revenue. So we're putting $600 million in, and $300 of that is not going to benefit the people of Minnesota. It's going right out the back door and going back into the federal lot. And we were told over and over, no, don't worry. We have every assurance that we're going to receive this federal waiver. Well, we have dueling letters here on the table, one handed out. They have the same Department of Health and Human Services letterhead on them. One of them is from Senator Benson and one of them is from myself. The one from Senator Benson is a governor's letter that went out to all governors. And it says that the feds are interested in such an approach as reinsurance. But the one I passed out says, you know, if you're going to do a reinsurance product and you expect us to approve a federal waiver, you have to make your model contingent on receiving that federal waiver. If you put your state monies up first, you're not going to get the waiver. And so the bill that we're asked to vote on right now, we're on third reading, there's no more amendments. I didn't really have the fix, but I did talk about it quite a bit and tried to get folks to understand that you know, Alaska was told this back in January that you know, if you want the 1332 to go through, it has to be contingent on an approval before you commit your state to implementing the program. And so the bill that we have before us actually does lose $300 million of federal funding. So it's got some very serious problems. We've got over $1 billion then. 600 put in, 300 lost. You know, that's lost money that we can't spend. I'm counting 1.2 billion to prop up 4% of the marketplace are currently engaged in our individual market. And it's at the cost of the Healthcare Access Fund that 20% of our people rely on the funds that we set aside to ensure access to quality, affordable health care services to support their life and their access to health care. Madam President, I think this bill needs a lot of work. I hope that the conference committee gets that work and brings back something that we can support in a much broader fashion on the Senate floor. Thank you.
Senator Gazelka.
Thank you, Madam President. Members, I want you to think back to just last year. I don't want to be long and historical, but all the plans were considering pulling out of Minnesota. Our governor and the Commerce Commissioner begged them to stay. I've since talked to all of them and talked to one of them, a number of them, but one of them talked about losing hundreds of millions of dollars in the individual health insurance market in just the first couple of years of MNsure. And they said even for a nonprofit, that's a lot of money to lose. And they couldn't afford to do that long term. And so the governor and the Commerce Commissioner begged them to stay. If they had left totally, the private market would have been gone, literally gone. And so you saw rates go up anywhere from 50 to 67%, 50 to 67%, which was also unacceptable, and access dwindling to virtually nothing in some areas. So the governor rightly said that we had to provide premium relief to those people that we bestowed this upon. We ruined their market. We put all the high risk into a narrow market. The rest of the folks in there paid sky-high premiums. We did that. Government did that. And so we couldn't get that done last fall. Elections do have consequences. There's a new majority in the Senate. And in January, that was priority number one. We worked with the governor in the House, and we passed premium relief to those people. But we did something more than that. We began the step towards reforming this system. Emergency premium aid is the first part. We did continuity or continuation of care for patients with serious conditions who have lost their doctors. We increased transparency for customers by requiring early public disclosure of premiums. We allowed for-profit HMOs to offer insurance in Minnesota. We were the only state that did not have that. We allowed farmers to participate in lower-cost group health plans through agriculture co-ops. We allowed small businesses to participate in stop-loss plans that reduce premiums for both employers and employees. We instructed the Commerce Department to research the benefits of allowing small businesses to offer low-cost, flexible benefit packages. And we reduced surprise billing by prohibiting in-network hospitals or clinics from using out-of-network providers without prior notice. Those are reforms. Those were beginning steps that we could not do before or did not do. That was step one. This is step two. This is step two. And all this does is secure the private market in this moment with reinsurance. This is not the end game. This just says that we're providing a way for the individual providers to be in the market. We want them in the market. We don't want them leaving. We want more access, which was the beginning of those reforms and what we want to happen as a result of this. But we're not out of the woods yet. We all have to roll up our sleeves to deal with costs. And I want you to think about what insurance is anyway. Is the problem the big bad health insurance companies? Is that what we say the problem is? Think about what insurance is. All insurance is protecting your risk of losing something great, so you put money in case you have that claim, so they've got some way of paying it. All an insurance company does, if they're doing it the right way, is they collect those premiums and they pay out the losses. What are the costs? That's what we haven't yet addressed. What are the costs? You heard Senator Jensen talk about if doctors give out sleep apparatus, I don't know what it's called, CPAP? You know, but if they give them out to people that don't need them, that's driving up the costs. So we have to look at the costs going forward, but also what are the options we provide to people to control the premium costs? Does everybody have to have a Cadillac plan? Minnesota mandates more coverages than virtually every other state. We say you got to cover this, you got to cover this, cover this. What if somebody doesn't want that? What if somebody just wants generic drugs if that means they get a lower premium? What if somebody says, you know, if I reach a certain age, I don't have to have a bunch of these medical procedures if in return I get a lower premium? We don't allow them to do any of that stuff. So if we're talking about how do we look towards the future, we have to look towards costs. And I would say it's not just the insurance company, it's a much, much bigger issue than that. But this is step two tonight, and it's our job to roll up our sleeves and move forward to make sure this thing works. That's both sides working together. That's why I'm a yes vote tonight.
Senator Marty.
Madam President, I wasn't going to speak again, but I wanted to comment on something that Senator Gazelka just said about insurance companies and their costs. And I don't believe that insurance companies are trying to mess up the system. I don't think anything of the sort. But I also think that when you look at how our system works, it makes no sense, and you can see why it drives up the cost. I think a good analogy is one we ought to look at. If we funded our schools the way we fund our hospitals, every teacher would have to spend at least a half hour every day sitting down at the end of the day, calculating how much time he or she spent with every student and how many supplies they used for every student. Then they'd send it down to the school's billing office. School's billing office would fold in all the overhead, the utilities, the supplies, And then they put it through something the hospitals call a charge master system, where they basically about triple the rates on everything, so the insurance plans can then negotiate that down. Then they'd send out bills to all the students and their families and their school insurance plans. And then those plans all pay for different things at different rates, and not every kid would have school insurance. And some of them couldn't pay the co-pays or deductibles, so the school billing office would need a collections office as well. And I'd like to know how that's going to improve the quality of our education system. It's going to take time of administrators and teachers away from teaching, send it into billing. It's going to make education worse. It doesn't improve it in any way, shape, or form. And it doesn't save money either. It adds a whole lot of new bureaucratic costs. It wouldn't mean that those school plans were bad people, bad businesses, but they don't need them. When you have something that every person in a society needs, like education and health care, and the amount you need may have nothing to do with your ability to pay, which is certainly the case in health care. Matter of fact, it's usually the opposite. The sicker you are, the less you are able to pay for it. So it's not a question of insurance companies being bad things. It's a question of, why do we need a health care system? If we're trying to cover everybody, why do we need to have that insurance system for it? If we did our schools that way, we'd spend a fortune. We'd all be wondering, what do we do? Maybe we can have a new system to get around it, and maybe we can do this to help make sure the insurance plans don't have to, they have a little bit of extra resources to cover the very expensive students, some of the special ed kids perhaps. We could do all those things. It would add money and add money and add money, and we'd all make sure nobody's overusing their education. And we'd spend a fortune more. So, Senator Gazelka, I just wanted to say that all those reforms you're working on help the insurance system work more. It's a broken system. And after 30 or 40 years of trying to fix it, we should recognize there's a reason we're spending twice what other countries are and getting worse outcomes.
Senator Dames.
Well, thank you, Madam President. But all I can say right now is wow. There's a lot of amnesia or short memories in this room, folks. Let's talk about the rates. From 2000 to 2012, the average rates for the individual marketplace was about 12% a year. 2014 and 15, they went up 18%. 15 and 16, they went up about 28% average. 16 and 17, they went up about 55%. We heard some discussion a little earlier about a storm. I think there is a storm, and I think the storm started in 2013, and the culmination was 55 to 67% rate increases in 16 and 17, 42,000 less people insured on the individual marketplace. And to show the storm started earlier in 2015 to 2017, there was approximately 100,000 people less on the individual market. So we have to start looking at how did that get there. And like I say, I think there's a lot of amnesia in this room, because I think we can look at a lot of this started in 2013. And we talk about what was required to be done in 2013, criticizing some members for not doing anything in 2011 and 12. That's fair game. The reality is in 2013, we did not have to create MNsure. We could have went on the federal exchange, and that took no action. We'd have automatically went on the federal exchange. I think it's also kind of interesting tonight how we brought livestock into the conversation. We hear about how we broke the pig, we're going to break the piggy bank. We hear about it's a pig in a poke. Well, let's talk about 213. As long as we're going to talk about livestock, let's talk about 213 when we created MNsure. To me, that was trying to put rouge on a pig, expect it to look good, and win a contest someplace, and it didn't happen. So I think we've got a lot of issues with where we're at tonight, but the reality is we're here tonight because of what happened yesterday. So we can sit here and we can have these debates, we can point fingers, we can argue, we can do whatever we want to do. The general public wants us to fix it. And they're looking and saying, what are you going to do to fix this? And I think that we need to look at something different than we have, because it is not fixing it. When you have people, and I've got some constituents, that were paying $12,000 in premium in 2012. In 2017, their premium was $34,000. 2012, their deductible was $1,000. In 2017, their deductible was $13,000. Folks, if that's not broken, then I'm totally misunderstanding insurance, and I think after 26 years, I probably have a pretty good idea how insurance works, and I think we got a broken process. This is what we have to deal with today. We have to get together. We have to deal with it. We have to make something happen and make something work. I'm going to ask you to support this bill because I think we can make it work. Am I going to stand up here and say there's no flaws in this bill? No, I'm not going to say that, because there isn't much legislation that goes out here. There aren't some flaws in it. You need to do some repairing. But I do appreciate Governor Dayton when he was the one that would stand up and say, the Affordable Care Act is not affordable. Most of in this room knew that, but most did not want to stand up and say that. Thank the Lord, Governor Dayton stood up and said that and started things in motion, and so maybe we can get something done. So members, thank you for the debate, thank you for the discussion, but I would appreciate your voting for the bill.
Secretary will take the roll on House File 5. The Secretary will close the roll. There being 37 ayes and 29 nays, the bill is adopted and its title agreed to.